When it comes to addiction, having the right support and recovery plan can mean the difference between life and death.
Yeah, that's absolutely true. And here to share some startling facts and figures are Brian Roach and Lindsay Gale-Forabuth, I hope I'm pronouncing that correctly, to talk about recovery in motion. So great to have you here. Obviously, this is an incredibly important topic, and it's affecting so many people, especially here in Tucson. So let's talk a little bit about Recovery in Motion, your treatment center, and what you offer people.
So Recovery in Motion is a full-service dual diagnosis treatment center. It's here in Midtown Tucson. We offer residential treatment at 30, 60, and 90 days. We also do outpatient treatment as well. We have medically assisted treatment or medically assisted detox for people that are struggling with detox symptoms so that they're safe and comfortable during that time. We have a fantastic family program. We do individual therapy, group therapy, and case management as well.
Mm-hmm. And somebody who is struggling, I mean, it's not just them who deal with the situation, it's also the family, right? So let's talk about the family dynamic regarding addiction and how you treat that.
We think the family dynamic is very important. It is once a week we call to give families an update on how their loved one is doing in treatment, so they're very much a part of the treatment plan and what is going on. We offer family therapy. We have family workshops every week for the family to get involved.
And so we were seeing some of the pictures there of your facilities in the treatment center and where people stay. So tell us about how the treatment center provides help if they're suffering from addiction. You mentioned there was like a 30-day, a 60-day, and a 90-day.
Sure. So the main thing that we focus on is therapy. You know, the therapy is one of the most important things. We want to make sure that the core issues are addressed. You know, trauma-informed care,
just services that really help people regain their life, right? I mean, you're putting them back on track. And let's talk about the opioid epidemic. We talk about that a lot. People may not really know the facts and figures, really how serious it is. So let's let people know what the actual issues are. What are the numbers looking like these days in terms of the opioid epidemic?
So really, we see that affecting everyone. Mm-hmm. It doesn't discriminate. You know, it's poor people, rich people, all levels of the socioeconomic classes are affected by that. And so we just want to be there to help people that are struggling with not only opioids, but alcoholism and all the other drugs too.
And we mentioned there were some startling facts to go over. And speaking specifically about overdoses here in Tucson, you see a lot of those?
We do see a lot of overdoses in Tucson.
It is overwhelming when you think
it's everywhere. It's everywhere. Yes.
It doesn't discriminate, like you said. And I mean, so much of this started off with like OxyContin and some pills, and then that's how it can kind of unravel.
One can lead to the other. They're all sort of interconnected in their own way. And so let's talk about the real difference between Recovery in Motion and, say, other centers. What's the real profound difference that people will find?
Recovery in Motion, we have a very intimate setting. We have a very high staff to patient ratio, so you get a lot of one-on-one time and attention.
So important, yeah.
And again, touching on the family program, it's something that really sets us apart. Someone may go into another treatment program and they will leave and their family doesn't know what happened. You have a contact person at the center who is letting you know what is going on in regard to your loved one's treatment, which is very important. So that's something that is definitely different with us.
If somebody's watching right now and they suspect that maybe a family member has a problem or they just get this inkling, what would you tell them to do?
Give them the support that they need, but also keep an eye out for maybe if they're sleeping too much or not sleeping enough. You know, there's different things that people may be doing that you can recognize to see if they need that help. Consequences at work, not showing up to work, maybe isolating more often. It's time to give them that support and then support them with treatment. You know, support them in ways that can help them overcome those barriers.
It all starts with a conversation, right? And seeing those signs and with a phone call too, right? If someone is concerned or for themselves or for a loved one and they call, what can they expect when somebody picks up the phone there?
When someone calls us, we will guide them through what they need to do, and if they're not a fit with us, we will help them go somewhere else. We want to help people in any capacity that we can, whether it's with us or not.
Well, and that's so noble because they need that help either which way, and whether it's with you guys, and you guys do such a tremendous job by all accounts, then somebody will be able to help them. So thanks so much for the important information. Nice to see you.
Thank you.
You too.
Our pleasure. Now, if you'd like to take a tour or maybe learn a little bit more about treatment and the treatment center, visit recoveryinmotion.com or call 866-418-1070.